Good evening and a very warm welcome to our respected guest speaker, Dr. Vivek Chadha sir, and all the delegates present here. I am Vaidya Yash Chaudhary, founder of Yes Art Vida Foundation, here to fulfill the aim of Yes Art, brings you this Global Ayurveda Talk 2024 to help our Ayurveda delegates in getting knowledge of how they can pursue their career in foreign countries. First of all, I appreciate your kind interest by joining our today's first session of the Global Ayurveda Talk. Your constant love and support uh, towards ESR, which motivates us to organize more such activities for our Ayurveda community. Till now, we had organized more than 30 plus online sessions, three national and international events in various countries like India and South Korea, and many more activities to come in the future. Now, without taking much time, I'm handing over to my co-host, Dr. Bhumika Tamar ma'am. Over to you, ma'am.
Good evening, everyone present here. Thanks a lot, Vedya Yash Chaudhary sir, for giving me this opportunity to introduce our first speaker of Global Ayurveda Talk 2024 from Canada, Dr. Vivek Chadha sir. As we all know, sir is well-known international Ayurvedic practitioner in Canada from more than 20 plus years. Sir is founder and director Ayucare Ayurveda Wellness Canada, director Ayurveda and Elite Research Council Canada. This webinar is in collaboration with our educational partner RGC Pre-PG Classes, Udaipur, expertise in AIPGET, AMO, NRHM and all other Ayurvedic exam. Gifting partner Level Up Ayurveda, our associate partner Dharma Ayurved, and our international partner Ayucare Ayurveda Wellness Canada. Now, without taking much time, I'm handing over to Dr. Vivek Chadda sir. Over to you, sir.
Uh, Thank you very much.
Uh, First of all, let me congratulate Dr. Yash for organizing this global Ayurveda talk. All over the world, Ayurveda is spreading like anything. Everybody is interested in Ayurveda. But real Ayurveda will reach each and every corner of the world when there are good institutionally qualified and passionate Ayurveda Vaidyas, doctors, start practicing in each and every country. It's hard, I know, to start establish Ayurveda if country does not have does have some restrictions, but still more awareness, more evidence-based Ayurveda practice will make it happen. One day it will be going all over the world, all over the countries. Definitely, we have to follow rule of the law wherever you are living. But certainly, this is a good effort. I really appreciate Dr. Yash and their all co-hosts for organizing this global talk. Is everything okay? Everybody is able to hear?
Yes, yes.
Okay, okay. Uh, so how to start, Dr. Yash? Let me know.
Yes, sir. Sir, you can start now.
Okay, okay. Yeah. So, so Canada, I say it's not easy to practice here because it's not recognized. Our degrees are not recognized here. But still, uh, there are some ways we can help people and start practicing here. And here, all the healing system, all the jobs are defined in National Occupational Classification. There is a code there that is called NOC code uh, 3232, which governs the traditional system of healing, practitioners of natural healing. In this category, there are certain things like traditional Chinese medicine, acupuncturist, aromatherapist, homeopathist, Ayurveda practitioners, and herbalist. So, what are these? These are categories which are defined as per their job duties, type of work, and skill level. So, these practitioners of natural healing, uh, in which homeopathics also comes, Ayurveda also come, herbalist also come, and traditional Chinese medicine also come. But unfortunately, only traditional Chinese medicine and homeopathy is regulated as per Canadian authorities. So what happens? So now you should understand what is regulating field and non-regulated field. Advantage and disadvantage both are there. So if it is regulated field, that definitely you should be having some formal education, at least 4 years education in this. Plus, you should have a registration with the regulatory body. So this works for traditional Chinese medicines and homeopathic. But for Ayurveda practitioner, herbalist, it is not a regulated field. So what happens now? So that means a person need not have formal education, but anyone having an experience can help people in in natural healing, making them feel good. So what does it mean? It means uh, we can help people to restore or maintain good health. But there is a restriction here that we cannot say. So you must have heard about it. Um, you should have heard about it, like not intending to diagnose. Let me open just a moment, please. Uh, so what happens, like not intending to diagnose, cure, or treat. This is the line they are using it, because this is just for restoring or maintaining good health. But you know, Ayurveda is everywhere. In routine, you can find a lot of fitness coach working in the West, work in the East, uh, who are guiding people about certain plants, about certain exercises, certain minerals, very, very common things here. So, as an Ayurveda practitioner, as an Ayurveda qualified, certainly we can help all these people in this area. Another thing which is most necessary here, that there is Canada Health governs a department that is called Natural and Non-Prescription Health Product Directorate. What does it work? It is a regulatory authority for natural um, health products and non-prescription drugs. So, so how it can be helping to a spread of Ayurveda here? So what does this natural health products mean? These are naturally occurring substances like plants, and we use it in our practice a lot. Uh, so as per Canadian regulations, there are certain safety parameters, efficacy, and quality standards which need um, to be put into place before we can dispense them. We can give it to anybody. We can advise to anybody. So these are vitamins, these are minerals, along with some herbal remedies. Uh, so when I started here, like 10 years back, maybe, so this was the uh, main hindrance for me, because I was not having enough combinations to work to help people restore good health. So I started working on it, and then in certain times I sent my formulations. So what happened? It was easily available. Ashwagandha was easily available here, and you can say turmeric was easily available. Everybody was eating those things, but these won't be helping to restore. If somebody is having some issues, then how can we help them? So I started working on that area, and then in maybe 2 3 years, it takes time. I have to send my formulations to them, and the good thing was there that they take the reference from Ayurveda textbooks like Brahmi. So Brahmi, if I send to them that I need to approve it with my formulations, so they will say reference, give us reference. So send them the Ayurveda text. So in my Brahmi capsules, there's a brain care capsules. So they gave a reference that Brahmi is traditionally used in Ayurveda as Medhya. So that was a plus point. And same way, um, in Punarnava, so we I cannot say the modern words, but I can say Mutral. So that's enough for me. So so I certainly worked on this area and made some good combination to help in Vata aggravations, Pitta aggravations, Kapha aggravations, or certain conditions, memory, dementia, like those type of things. This thing, so this helped a lot in establishing this practice here. Although I have to be cautious, anyone who is practicing in North America has to be cautious. But there are certain ways we can be. I can advise people who are interested in practicing in these countries. So instead of going by the modern diagnosis, you can just go with your diagnosis. Not needed that you have to just write gout, arthritis. You can write Sandhivata. You can write Amvat. You can any type of issues. You can write it. So, so here restriction is because uh, there is a certain act, I think, that is called controlled act here. So what does controlled act mean? It means making a diagnosis is not allowed apart from the people who are uh, in the Regulatory Health Professions Act. So, so diagnosis we cannot make, but we can write in the terms of Ayurveda. I can do pulse reading. I can advise people that is vata aggravation is there. You have to balance your vata, or pitta aggravation is there. Have to balance pitta. But there are certain controlled acts restrictions are there. We should be much thinking about those things, what not to do. So there was a question earlier, like panchkarma and all those things. Certain limit. Abhyanga is okay, but performing procedures is not allowed here. Here, controlled act says performing a procedure below the dermis. So what does it mean? So it means suturing, means scaling. So below the dermis, you cannot do it. Setting or casting of a fracture bone, you cannot do it. Administration of any instrument beyond any natural opening, you cannot do it. So what does it mean? So we cannot put inside the ear canal. We cannot go above this restriction in the nasal area. We cannot perform basti. So certain restrictions are there. So this means as per rules, we have to do because there is less awareness. Now we have some organizations working on this area, trying to collaborate with different health authorities, provincial authorities to get it uh, approved or get it regulated. Only then we can be able to perform in full Ayurveda. But still, there are a lot of scope. Um, Restrictions are there, but still we can definitely practice as per regulations, as per rule of law in Canada. Dr. Yash, anything you want to know? Let me know what to say.
Sir, your voice is not clear.
My voice?
Yeah, now clear, sir.
Okay, yeah, I'm saying let me know what you want to know. Uh, any type of information you want to know, just let me know. I can explain more about that thing.
Sir, questions are in the chat box.
Okay. Are we considered as doctors there? We should be proud of getting Vaidyas, Ayurvedacharyas. I would say it this way. Uh, can we administer herbs to patients there? Yes, administer. What do you mean by administer? Like you can give herbs. There are certain formulas you can advise. This is a good combination for you. For memory, you can give some Brahmi, Shankpushpi. You can mix some herbs. You can give the person an herb uh, for any type of issues they are having. How can we enter into practice there? Now, for practicing here, you have to follow the provincial rules, like different in India terms. You can say there are states here. So there is state Ontario, there is British Columbia. So as per rule, we have to go by their rules. As it is not regulated, so anybody can practice Ayurveda then. Not needed that they should be having full institutional qualification here. So that is a drawback too, because there is no regulation there. But soon it will be there. Okay. Kanpurun or
Sir, various delegates are having a question regarding what's the scope of Ayurveda in Canada.
yeah. Uh, so scope of Ayurvedic practice. So there cannot be a clear definition of scope of Ayurveda practice. Because usually when the regulations is not there, so regulation is not there, so associations play a great role there. So like in the US, there are NAMA, APNA, there are different associations which are working on. By chance, in Canada, there is not such an association which is having this type of here. But assessment of body system disorders like dosha evaluation, pulse reading, therapies like Abhyanga, counseling as per Ayurveda, doshas, diet, lifestyle, that can be done uh, here.
Sir, is any other degree required for the Ayurveda
No,
practitioners to practice in there?
no. As I told that there is no regulation here, so no extra degree, nothing is needed. Now the question is regarding immigration. So that's not in my field, but still, just look at National Occupation Code, look at job duties. So there is a difference between for immigration purposes, there is different thing going on. So if your job duties are matching, you can just if you are even uh, graduate here, but you are managing a hospital, you can come here as a manager too. But for Ayurveda practice, or you don't have any regulated authority to practice here.
Sir, what's the courses available as master programs after the BMS
No,
if
so there
anyone
is
want to settle there?
yeah. So again, I'm saying that there is no such course, no. We have to go to the other alternate fields. Like if you are a BMS here and you want to start something, so you have to go in different fields, not master's field here. There is clinical research field, there is psychological counseling. Yeah, that is like there is the psychological master's is there where your degree get valid and you can just do uh, that degree for 2 or 3 years and then you can come in the field. But for particularly MD purposes in Ayurveda terms, there is no such university offering such courses.
Sir, what's the roadmap to the Canada if any Vaidya want to pursue their future in Canada and want to practice over there? So how they can do it?
Now it's getting more tougher. But uh, look, if you want to immigrate as an Ayurveda graduate, I think it's not possible nowadays. Earlier, like 15, 20 years back, they were matching their job duties with the family physicians here. Like you were managing a hospital, you were advising patients, you were advising referring patients, you were taking reports and compiling them, consulting super specialists. All these job duties were matching earlier. But now, uh, only code is practitioners of natural healing. Immigration is very tricky questions, not my field, but still, this is the code only which is in Ayurveda practitioners can come over here, like practitioners of natural healing. NOC 3232. You can look at it, look at details, but it depends on the requirement here. If if Canada thinks that these people are needed for such time or for such actions, only then they request people to come over here.
So, does Canadian patients cooperate with Ayurveda practitioners?
In Canada, yeah, yeah, there are a lot of practitioners here, a lot of leading practitioners here. There is a lot of good interest going on. In last 3 4 years, it has like increased a lot. More and more people are interested about Ayurveda. They, even the natives here, they may not be knowing about Ayurveda, but because of yoga, they know about there is allied science there. So, and now by the social media, they are knowing about it, trying to find about it, and you will be surprised that I've found a lot of people going for Panchkarma in South India to uh, get all those Shodhan karmas there. So definitely, big interest is going on. Uh, if you are interested, if you are here, you can certainly start a practice here, and I can help in that area if somebody wants any guidance there too.
Sir, does Ras These are allowed in Canada?
No, Ras Aushadhis are definitely not allowed anywhere in North America because of some, they think that it can cause some toxicity, metal toxicity anywhere. I would, so I would rather encourage people to practice Ayurveda, but follow the rule of the law. If Rasa Sujdi they are not saying, don't try to administer, don't try to give it to them. Go by the law, whatever it is saying. Like it's saying that it has to be approved with natural NNHPD. So how does it say? I will just show you this. So there is 8 digit number. Like here, there is a number there. You have to get this number. You have to get uh, this certification from Canada Health. Only then you can dispense something. Open powders, you can mix them. Is it okay? But if it's in the packed form, it is in the capsule form, or it is in the packed form, certainly you have to get it approved from Canada Health. Only then you can advise somebody to take it.
Sir, according to you, there is tough rules and regulations for practice of Ayurveda in Canada.
Yes, more
So, sir,
tougher is to immigrate.
any other country which you want to convey, like which
But I will say that certainly, uh, certainly you cannot say you are a doctor here. Certainly you cannot diagnose. You cannot say diagnose in the modern terminology. Okay, in the modern terminology, but you can practice your natural healing. You can advise people how. Okay, the problem is that like everybody's in a rush to go. Look at it how it can work. Uh, Even in the Ayurveda, what is the health definition? Swastha se swastha rakshana. If people living here, Ayurveda acharyas living here, start just swastha se swastha rakshanam, that is a big field here because people are so conscious about their health. For disease, but diagnosis is different thing. But for they are so conscious about their health that certainly you can advise people about how to what is the roadmap to good health. Again, this way you can also help people to reduce the cost which is going to happen if they get sick. So again, my take is I work on the principle like swastha se swastha raksha. Go with it. It's very easy. Aturasya vikar prashman, definitely. But again, you have to take care of the law, which is saying what to do, what not to do.
sir, herbal medicines or herbs are available over there?
Definitely. Herbal medicines, all herbs are available. You even think about it, everything, every herb in raw form, in powder form, all herbs are available. Certainly, definitely different combinations, are available nowadays. There are certain companies who are promoting their company. I will just give an example of like brain care. What is it having? Brahmi, Shankpushpi, and Ginkgo biloba. A good combination. And when you get it approved, they gave in indications, they have given it that Brahmi is used is traditionally used in Ayurveda as Medhya. So that is sufficient enough for you to help the people which are having memory loss, or you who want to rejuvenate their brain biochemistry, uh, Medhya work. We can just easily do it. There are a lot of examples I do have, uh, which can be helping in this area. In liver care, I have a combination which is having a combination of Punarnava, Bhui Amla, Bringraj, Glow, and Kalmek, 5 herbs. Good enough if you have like 5 herbs in a combination you have to, with you, and you can certainly help in those areas. So it can be helped in that area.
Sir, delegates want to know how you started your practice in Canada.
Same way, yeah, it was very tough, but when I came here, I looked at it that what is the difficult. I came to know that we have to write it not intended to diagnose, treat, or cure, but herbs were there. When I started, there was just ashwagandha, brahmi in raw form, in single herb form available here. Then I looked at it that how I will be able to help people more without combination. So then I thought about it, and then I started approving, getting approval from an NHPD. What are the products which are easily available? Easily I can make them. So I made combination. I have Vata Care, which is a combination of ashwagandha, shatavari, conch, rasna. You think about it. So as a Vata, what you want? You want something which is nourishing. So all the herbs I combination I used ashwagandha, shatavar, conch, rasna. Vata Care is there. I may be having where do yeah Vata Care. So and for Pitta Care, I just uh, get a combination approved from here, which is Amla, Mulatti, and Giloy. Kapha care, liver care. So this brain care. So I just worked on this. So I was in the, it was in the mind that before, without these products, I won't be able to practice anything here. I won't be able to help people here because alone ashwagandha cannot help each and everyone. Alone Shilajit or alone 2, 3 herbs cannot help. I need a combination. So I started working on that area. And right now I have 24 formulations which are approved by Canada Health. So this helps a lot. And you know, when the combination is there, it is certainly much better than single herb. So I was just looking at if I can help some colon care. The main thing I looked at is a lot of patients having 2, 3 fields. I diagnosed what I thought about it. What is the main issues here? Like indigestion is the main issue here. Like colitis, sangrani is the main issue here. So how to help it? So I made a combination of kuch, bale, anar, musta, nagarmota, so that this combination, even if they don't give clear indications about usage on my product, but still I know them that this is going to help best in sangrani. So that way I just started it, and right now having a good 24 combinations with me, 3, 4 more sent. So it starts evaluating, it starts working when you are passionate about it. It is the interest. I was thinking about it that I have to start Ayurveda only. I was passionate about it, and whatever the whatever the hindrances were there, still uh, I'm able to practice Ayurveda.
Sir, what's about the salary package and earning of Ayurveda doctor in Canada?
Look, for salary purpose, not good here because what happens like um, if you are doing just consultations only, you are not able to perform proper therapies. For therapies, again, so certainly if you are interested in therapies, you have to get licensed as per the need. For massages, you need to have RMT license, that is called registered massage therapist. So you have to get those therapies. If you get a license, there is a good salary package there. Definitely, it's a good, so much more than anybody can think. So, but for that you have to just upgrade yourself. You have to go side stream. You have to go. You cannot say in Ayurveda perspective as a Ayurveda helper, Ayurveda assistant, not great because if I am working alone, I'm just doing consultations. I'm just doing advising alone. So I won't be needing anybody help here. If one person is okay with me. So that's why it's not a, until unless it is regulated, only then salaries we can think about it.
Sir, how like options like MPH and MHA in Canada after VMS is what a student can do that course and settle over there?
Yes, yes, that a lot of people do this way. They just go with the other courses which are related to health, related to this. Like I gave an example of master in psychological counseling. Good course there. University is doing it. uh, and this way you can just do start your life here.
Sir, if any practitioner made his own medicines, then he need to take any license or any permission from the government or
uh, if you are doing it for yourself, you don't need that thing. If you are mixing yourself for somebody to have, you don't need anything. But if you want to sell it in a packaged form, if you want to sell it to other people online, then certainly you have to get it approved from Canada Health.
sir, a Vaidya can directly get a license over there.
For what license you are saying?
Sir, for practice.
Again, the same answer is like it is not regulated here. It doesn't mean if you are BMS or just having a 2 year, just having a knowledge about it. It is you can practice it here.
Okay, sir, according to you, if someone having a knowledge of it, then he also can practice over there.
Yes, until and unless it is regulated. When it gets regulated, then you will certainly need a certain hours. Like there are certain degrees in US. There 500 hours of the course you needed. So there will be certain restrictions then. But until unless it is regulated, non-regulated, anybody can do that.
Sir, according to you, which country is best for practice of Ayurveda in abroad?
I love living here, so for me it's best here.
But sir, you told that it's tough situation over there.
It is tough there, but still, maybe in 3 4 years, more people are there. Until and unless we make people aware about it, how will Ayurveda get regulated? So, if the people don't start practicing Ayurveda, we don't show people the evidence-based Ayurveda here, so it won't be easier to get it regulated. It may be it from last 4 5 years, a lot of people, a lot of organizations trying to do it regulated here. So maybe in the next 3 4 years, it will be regulated here. So then it will be much easier because then you are a qualified institutionally graduate and mm, you have just to get it registered with the board. But until this, certainly there are some hindrances, but I'm okay with it.
Sir, any association or regulatory body of Ayurveda over there?
Yeah, there are 3 4 associations going on which are working in that area. So definitely, we have to be a member of any organization to just to just to just make ourselves regulated. It's not governed by the country, but still, uh, self-regulation is the most needed here because uh, there are certain ethics, certain certain way to practice. So we should be knowing about those things first.
Sir, medicines of Indian brands like Dawar, Badnath, or Emil, or any other are available over there.
Uh, ideally, it is not allowed to have any medicines which is not approved by Canada Health. Even from the US, Canada is a difficult country in this way because you have to get it approved from here. Even Himalayas, certain products are available here, but they are approved here. They got their products approved here. Same way, different companies are doing it. If they are approved here, then we can use it.
Sir, as you told about massage therapist, what are the scope and salary of them, and any course
Yes.
related?
So there is maybe 8 months course for registered man. I'm just not sure about it. So RMT course is there. Usually people for 1 hour massage, usually people charge it $120. So that is a good salary, good package for everyone. For that, you have to just do that course, maybe 8 months or 1 year, 2 years, I'm not sure. And then you can get registered with that board, and then you can start your practicing, or you can just join uh, any of the organization there. As it is a big field here because of insurance backup. As insurance, everybody is paid for the massages, so that also a lot of a good number of our one or two doctors are also having therapy centers. They are having RMTs there, which are performing massages there.
Sir, what are the process to get medicine approved over there? As you told about that number on the product which we need to get
Yes,
approved.
yeah, yeah, yeah. So that is called natural product number. So any natural health product is get have to be approved from NNHPD. That is, I told you that regarding this, uh, that is called Natural and Non-Prescription Health Product Directorate. It has to be approved. So we have to send the formulation to the directorate along with references. Like I use the references of Ayurveda text. So that way they look at it. If they have any clarifications needed, they will ask you to clarify it. Like for kapha purposes, I was more interested in Marish black pepper, but they were not thinking that they were thinking that it can adversely affect in GI bleeding. So they asked me to reduce the dose of black pepper in your formulation. So I have to reduce it. So, but that can be reference. So they gave me an example that black pepper can cause severe gastritis, or it can lead to GI bleeding if there is any issues with that. So, so I just reduce the dose of about it. So we can give a reference about Ayurveda. There are certain 2 3 books which they look at it, and they then they give an uh, approval about it. Like so, recommended. It's written in my product like it is traditionally used in Ayurveda as a laxative for the relief of occasional constipation. So this is my formula about as a laxative, you can say, I mean, Trifla along with Amaltas and licorice, Vatnaluman and all the work done. So I thought about the formulations of as per practice, how I will be needing them. So Trifla is very much common here, but I added Mulathi, I added Amaltas in it so that I get Vatnaluman and other effects too. And look at it, they wrote I just wanted to write it in Ayurveda way. So they just did it. Traditionally used in Ayurveda as a laxative for the relief of occasional constipation. Good enough for me. So I can use that product in here. So then I have to give them reference what is the purpose of Amalta, Mulatti, or Trifla. So they will look at it. If not any having questions, they will just approve it, or they will just ask more for qualification. Colon care, I told you that Kurz, Bale, Anar, Nagarmota, Musta combination. So I try to use the word Sangrani, granny in it. So that way, because you cannot write that colitis, IBS, something like, but traditionally used in Ayurveda for grahani, it solves my purpose. Um, People may not be understanding, but I know about it. So that way we can just ask, send them um, with the references, and they then approve it and give a number to you, 8-digit number to it. You have to label restrictions, whatever they say for cautions, whatever they say for recommended use, dosage, you have to make label as per their written document in both languages, English and French, because these are two languages. So we have to write in English and French, both the things as per label document, product label. We call it product label. So whatever is approved by them, we have to write each and every detail, or each and every caution about it. A lot of cautions they put in on it, that you cannot give it to it, hypertension, kidney disease, all those things. But still, there is the formulations get approved. Takes time, maybe usually now it's taking more than 1 year to get it approved. Earlier it was 8-9 months. But certain formulation, if they are single herbs like Brahmi, you want to get it Brahmi approved with you, so it's very easy then. So it will be just approved in 45 days. But if you have a combination more than three herbs, then they look at it bioavailability, assimilability, how they combine can be having any helping or having any adverse effect. Like I told you, for Brahmi, Shankpushpi, and Ginkgo biloba combination, they took time. They look at all the references. Then they approved it. I approved for energy levels. I approved ashwagandha shower or conch combination. They took time, but then it's a tier 4 type of combination, more than 3 or 4 herbs. Then it takes time, but it gets approved.
Sir, if any practitioner registered as a massage therapist over there, and after that he will do consultation, is it possible?
Consultations, it can be done. You can say, you can advise, you can help people. There is certain like words we have to use. You can, like I showed you, what you are doing, you're traditional helping them. You can help them, advise them. You cannot say it's a consultation.
Without saying consultation, we can do that. Sir, as nowadays hemp is getting trend in Ayurveda industry, is it legal in Canada?
Okay. Yes. Okay. Cannabis is a big field here. Uh, um, there are a lot of other things going on, um, but that is totally different field now here. So I'm not very much knowing about it, but certainly cannabis for recreation purposes, for other purposes, is it used here? But for medicinal purposes, I'm not using it here.
Sir, is any role of Ayurveda research over there?
Yes. Ayurveda research recently, I think government of India has collaborated with university, have some UHN here for researches going on. And until and unless these type of collaborations happen a lot, it won't be easier to get it regulated here. So my effort is always here to get it regulated, so that each and everyone, or my community or my colleagues, can start practicing here without thinking about it, without risking anything. Um, Another thing I mentioned it. Still, if you it's so what you are advising something. It is one to one. It is one to one understanding between you and your client. You can say. So you have to be very particular about like documentation that you get their nod, consent to help. Another thing is liability insurance. You have to be getting a liability insurance so that anything wrong happens, you are fully covered. So these two, three things we have to take care of it.
Sir, Agni Karma, Vid Karma, or Char Sutra is allowed over there.
Sharpshooter for sure not allowed. And I told earlier too that anything which is going to touch beyond dermis is not allowed. That is only for family physicians to or registered ones to start it. So anything beyond dermis, you cannot do anything. There is a question about skin problems. So again, so even telling pathe and apathe, even advising people what is going to cause Rakt Dushti, Pitta Dushti, even without certain rasas, it can be helpful. People are ready to pay you for your opinion, and you are expert about it. You can certainly help people to avoid certain things, to make certain changes. So, what I do, I advise people as per Ayurveda how to balance themselves in terms of doshas. And I have seen just balancing yourself solves the problem, like 80% of the problem. So, so there is a way of thinking about it, not rushing to do each and everything, uh, not rushing to do panchkarma if if it's not allowed here. So my thinking is that just on safer side, you can practice Ayurveda.
Sir, what kind of jobs are available with an Ayurveda certification or degree apart from Vaidya?
Uh, Apart from that, you can join any of the uh, like healthcare centers, uh, different type of for scheduling purposes, for helping people regarding. So not easy to say about like particular for Vaidya related, but definitely for management related, you can jobs you can get here.
Sir, I think we should end now, and I don't think there is any more question.
Thank you very much. Really appreciate. I know it is very tough when people look at it that it is not easy to practice uh, Ayurveda, but it's way of seeing about it. If you are here, you can certainly help people. You can certainly earn a good amount of money if you are really passionate about it.
Sir, on behalf of a whole Yes Art with a family, I am too much thankful to you for giving your valuable time to us.
Thank you very much, Dr. Yash, and really appreciate your all effort. I hope a lot of people take interest in Ayurveda, and then we are able to spread Ayurveda all over the world.
One more information for all the delegates is there. Tomorrow we will having a second session of our conference of Global Ayurveda Talk. Uh, a speaker from USA, Dr. Bhaswati Bhattacharya ma'am will join us tomorrow. So please be ready tomorrow at 5 p.m. to 6 p.m. And all the informations will be shared in the group. So good night, keep in touch. Jai Dhanvantri.
Good night.
Recording of this session will be available on our YouTube channel. You can go through it. If you are having any questions, you can ask in the comment box over there, or you can directly DM us. And I request you all, please